Hello, Namaste. Welcome to my channel KN Class. Today's topic is opioid analgesic and antagonist. The opioids includes natural opioids and the semi-synthetic alkaloids derived from the opium poppy, pharmacologically similar synthetic surrogates and endogenous peptides. Classification according to the source: natural opioids, codeine, morphine; semi-synthetic opioids, dihydrocodone, oxycodone, buprenorphine; synthetic opioids, pethidine, nalbuphine, fentanyl, sulfentanyl. According to the efficacy: low, moderate efficacy and high efficacy. Low, moderate efficacy: codeine, dihydrocodone, pentazocine. High efficacy: morphine, pethidine, tramadol, nalbuphine, fentanyl. Opioids. The main three headings for the opioid classification are agonist, mixed agonist, antagonist, and antagonist. So, agonist is further divided into three headings like the strong, moderate, and weak. Among the strong agonists are the morphine, methadone, and meperidine. Moderate agonist, codeine, oxycodone. Weak are the propoxyphene. Mixed agonist antagonist are the buprenorphine, nalbuphine. Antagonists are the naloxone, naltrexone. When there is any adverse effect of opioid, then the antagonist of opioids are given like the naloxone and naltrexone. Some of the terms used to learn: opioids, a drug used derived from the alkaloid of the opium poppy. Opioid, the class of drugs that includes opioids, opiopentyns, and all the synthetic and semi-synthetic drugs that mimics the action of the opioids. Opioid peptides, endogenous peptides that act on opioid receptors. The peptides I'll be stating later on. Opioid agonist, the drugs that activate some or all the opioid receptor subtype and does not block any. Partial agonist, the drugs that can activate an opioid receptor to effect a submaximal response. For example, if the opioid agonist activates 100% the receptor, then the partial agonist will not activate 100% but less than 100%. Opioid antagonist, the drugs that block some or all the opioid receptor subtype, like the naloxone. Mixed agonist antagonist, the drugs that activate some opioid receptor subtype and blocks all the opioid receptor subtype. Means mu, it may activate and it may block the delta or kappa. Opioid receptors. There are three receptors: mu, delta, and kappa. Mu causes the clinical effect like the analgesia, smooth muscle tone, sedation, mood alteration, nausea, vomiting. The location are the mesenteric plexus, brain, spinal cord, submucosal plexus. Delta receptor is present in the mesenteric plexus and the brain, which decreases the colonic transit time. So it helps in the treatment of the diarrhea. Though the kappa, mesenteric plexus, brain, and spinal cord, causes the central analgesia, decreased colonic transit time, visceral nociception antagonist. Pharmacokinetics. Morphine, hydromorphone, and oxymorphone undergoes the extensive first-pass metabolism. That is, these drugs are being metabolized by the hepatic enzyme in the liver. So, oral medication is contraindicated. So, morphine A and hydromorphone, these are the drugs given by the intravenous route, so that the bioavailability of the drugs is 100%. Fentanyl is available as a transdermal patch. Opioid drugs are widely distributed to the tissue, so they cross the placental barrier and exert the effect on the fetus that can result in both respiratory depression and with the continuous exposure physical dependence in the neonates. So it is contraindicated in the pregnancy. Metabolism. The opioids are metabolized by the hepatic enzyme. Mechanism of analgesic action by the opioids. Three major opioid receptor subtype have been extensively characterized. As I have already said, there are three receptors: mu, delta, and kappa, and which are present in the spinal and the supraspinal level. So whenever the opioid drugs is being given, it acts on the opioid receptors, which gets activated and produces the endogenous peptides under the physiologic condition. These peptides, which includes the endorphins such as the alpha endorphin, enkephalin, and the dynorphin, are synthesized in the cell body and are transported to the nerve endings, where they accumulate in the synaptic vesicles. The endorphin has the highest affinity for the mu receptor, enkephalin for the delta receptor, and dynorphin for the kappa receptor. All the receptors are present in the synaptic cleft The presynaptic releases the endogenous peptides, whereas the receptors are present in the postsynaptic membrane. Following effects occur. Receptor, as I have already said. Note: respiratory depression. Opioid action in the medulla leads to the inhibition of the respiratory center with the decreased response to the carbon dioxide challenge. Whenever there is increase in carbon dioxide, partial pressure of carbon dioxide increases, the signal goes to the medulla, due to which it increases the respiratory rate and balances the partial pressure of carbon dioxide and oxygen within the body. But when the opioid is being given, it leads to the inhibition of the respiratory center, due to which carbon dioxide level increases. So carbon dioxide is one of the vasodilator which causes the cerebrovascular dilation, resulting in the increased blood flow and increased intracranial pressure. Opioid analgesic are relatively contraindicated in the patient with the head injury, as there is the increased intracranial pressure. It causes the headache. So in case of head injuries, the opioid drugs are being contraindicated. Clinical uses: analgesia for the relief of the pain. In the extreme pain, we give the morphine. Cough suppression of the cough reflex, but large dose of the dextromethorphan may cause the hallucination, confusion, excitation, increased or decreased pupil size, nystagmus, seizure, coma, and decreased breathing. Treatment of diarrhea: selective antidiarrheal opioids including the diphenocylate and loperamide, they are given orally. Treatment of diarrhea, as I have already said, it decreases the colonic transit time. Management of the acute pulmonary edema: morphine in IV route may be useful in the acute pulmonary edema because of its hemodynamic action. Its calming effect probably also contribute to the relief of the pulmonary symptom. Anesthesia: opioids are used as a pre-operative medication and as intraoperative adjunctive agents in the balanced anesthesia protocol. High-dose intravenous opioids like the morphine, fentanyl are often the major component of anesthesia for the cardiac surgery. Opioid dependence: methadone, one of the longer-acting opioids, is used in the management of the opioid withdrawal states and in the maintenance program for the addicts. In withdrawal states, methadone permits the slow tapering of the opioid effect that diminishes the intensity of the abstinence symptom. Adverse effect or toxicity: overdose, triad of the pupillary constriction, comatose state, and the respiratory depression. There is the three triad of the overdose of opioids, like the pupillary constriction, people gets constricted, comatose state, the person goes to the coma, and respiratory depression. So the person should be kept in ventilator. Drug interaction: important drug interaction including the opioid analgesic are the addictive CNS depression with the ethanol, sedative hypnotics, anesthetics, antipsychotic drugs, tricyclic antidepressant, and the antihistamines. Use of certain opioids like the meperidine with the monoamine oxidase inhibitor, that is MOI, increases the incidence of hyperpyrexic coma. Meperidine has also been implicated in the serotonin syndrome when used with the selective serotonin reuptake inhibitor. Contraindication: head injury, pregnancy, increased intracranial pressure. Thank you. Share and subscribe my KN class. I will be uploading next video soon. Thank you for watching.